Understand how alcohol and anxiety are more closely related than you may think. Part 1 of 5. Overview: Understanding anxiety. Some people try to soothe their anxiety with alcohol. When dealing with stressful days or nervous situations, you may be tempted to have a glass of wine or a beer to calm your nerves. But alcohol is not a medication. And drinking alcohol, especially heavily and for the long term, could actually increase your anxiety. Additionally, drinking alcohol can have serious consequences for people being medically treated for anxiety. While having a drink might seem like a good idea to ease anxiety, you may be doing more harm than good. Advertisement. Part 2 of 5. Alcohol effects. Unwinding with alcohol. There is some truth to the belief that alcohol can reduce stress. Alcohol is both a sedative and a depressant that affects the central nervous system. At first, drinking can reduce fears and take your mind off your troubles. It can even help you feel less shy. You might experience a boost in mood, but the overall result is relaxation. In fact, the effects of alcohol can be similar to those of anti-anxiety medications. Occasionally, unwinding with alcohol isn't necessarily dangerous if your doctor approves. The problem is that once you start drinking, you can build a tolerance to the de-stressing effects of alcohol. This can make anxiety and stress even more difficult to cope with. Part 3 of 5. Consequences: How alcohol worsens anxiety. When it comes to anxiety, alcohol can be a cause for concern. Alcohol changes levels of serotonin and other neurotransmitters in the brain. This can make your anxiety worse. In fact, you might feel more anxious after the alcohol wears off. Alcohol-induced anxiety can last for several hours, or even for an entire day after drinking. Using alcohol to cope with social anxiety disorder can be dangerous. According to the Anxiety and Depression Association of America, ADA, about 7% of Americans have this form of anxiety. A person with social anxiety may find social situations unbearable. It's common for people with social anxiety disorder to drink alcohol to cope with social occasions, but this can lead to a dependence on alcohol during socializing. It can also make anxiety symptoms worse. The ADA estimates that 20% of patients with social anxiety disorder also suffer from alcohol dependence. Besides needing alcohol to socialize, other signs of dependence may include needing a drink to get going in the morning, drinking heavily 4 or more days per week, requiring a drink at every get-together, inability to stop drinking, drinking 5 or more alcoholic beverages in one day. Overconsumption of alcohol can also lead to another cause of anxiety: hangovers. A hangover can cause symptoms that make you feel more anxious than before, including headaches, dizziness, nausea, dehydration, low blood glucose, sugar. Part 4 of 5. Possible cause: Can alcohol cause anxiety? The long-term consequences of alcohol abuse can lead to a variety of health concerns, including mental health disorders. Many believe that heavy drinking might actually lead to anxiety. Research from the University of North Carolina School of Medicine shows that alcoholics find it difficult to recover from traumatic events. This is possibly attributed to the effects of alcohol abuse, which can actually change brain activity. Given these findings, there is a concern that long-term heavy drinkers may be predisposed to developing an anxiety disorder. However, there is no evidence that moderate drinking will cause anxiety. Part 5 of 5. Risks. Bottom line: alcohol isn't anxiety treatment. Moderate drinking is not the same for all genders and age groups. The term refers to 2 drinks a day for adult men, and 1 for women. Since older adults metabolize alcohol faster, this age group should be limited to 1 alcoholic beverage per day. Check with your doctor if moderate alcohol consumption is suitable for you. Remember that the risks of alcohol can outweigh any benefits. Some risks include depression, obesity, liver disease, cardiovascular damage. Alcohol affects everyone differently. It can cheer some up after a rough day, while others might feel the more of the sedating effects. Discuss concerns with your doctor first, and see if alcohol is safe for you. Keep in mind that you may not safely drink alcohol if you have a low tolerance for drinking, anxious or aggressive tendencies, a mental health disorder. Alcohol isn't a source of anxiety treatment. Seek help from a mental health professional, not from a bottle of alcohol if you have an anxiety disorder. If you think you have a problem with alcohol, seek help from your doctor right away.